Hello, everyone. Good morning, good afternoon, good evening. We'll get started today as folks start to trickle in. Feel free to introduce yourselves in the chat. The chat should be open and you should be able to add your questions and other comments in there. My name is Darcy Anderson. I'm a senior researcher with the Water Institute at the University of North Carolina, and I'm very excited to welcome you to our webinar today on the Global Framework for Action for Wash and Healthcare Facilities. I'll start with just a couple of announcements. For those of you that have been following our Washington Healthcare Facilities Community of Practice, our monthly newsletter will be joining forces with the WHO and UNICEF newsletter. So our COP content will be included as a feature in the WHO UNICEF newsletter, and there will be no separate monthly COP. If you're not currently registered for the WHO UNICEF newsletter, you can do so by visiting washingtonhcf.org, scrolling down to the bottom of the page, and filling out your information in a box that will look like this. Our agenda for today, we have a speaker from WHO and UNICEF who will introduce the Global Framework for Action, and then we have two very exciting country case studies, one from the Philippines and one from Nepal. And then we'll close out with a moderated Q&A session. If you have questions during the presentations, feel free to add them to the chat, and we'll hold on to those and we'll answer them at the end. So without further ado, I will introduce Lindsay Denny. Lindsay Denny is a program specialist at UNICEF HQ who is leading on wash and healthcare facilities and hand hygiene. Lindsay?
Thanks so much, Darcy. And it's fantastic to be with you all this morning, this evening, wherever you are tuning in from. As Darcy said, I'm from UNICEF, but I'm here on behalf of the WHO and UNICEF team. My colleagues, Arabella Hayter and Maggie Montgomery, are also here in the chat, and they'll be chiming in. There's a group of us working to move this issue forward. So next slide, please. So you all are here for a reason. I assume you are familiar with the background, but just as a reminder, there is, of course, a growing imperative for better wash, waste, and electricity services in healthcare facilities. Between reducing costs and saving lives, being fundamental to ending preventable maternal and newborn deaths, to being supportive in the growing crises and emergencies, and of course, helping to meet the commitments of low carbon and sustainable healthcare facilities, we know that it is critical we have these services available in all healthcare facilities everywhere. So please, next slide. To build up on this, there's been a global community that's been moving forward to strengthen wash, waste, and electricity services in healthcare facilities. And this really started back in 2019 with a strong momentum. There was a World Health Assembly resolution that pushed forward wash and healthcare facilities, as well as a global baseline and guidance on the issue launched in 2019. In 2022, there was a launch of the updated Wash Fit package that focused on climate and equity. And then later that year, there was a global update on the SDG 6 services of wash and waste in healthcare facilities. Last year, we published the Global Progress Report and had a global summit with over 30 countries coming together in Jordan. And then later that year was the first global report on electricity. And then in December, the UN General Assembly passed a resolution on wash, waste, and electricity in healthcare facilities. And I'll give a bit more detail to this, but that's really what's launching us into this next phase. And of course, in May, we published the Global Framework for Action, and I'll describe what that looks like. Next slide, please. So this 2023 progress report is really critical to how we got to where we are today. And this is really the outline that we use, the structure we used to build the resolution and the framework. So this report came out and it included data from over 70 countries looking at their progress on the 8 practical steps. And we saw that in certain areas, countries are making a lot of progress. For example, 80% of countries are finalizing and implementing updated waste standards. So we see on these technical sides, situation analyses, roadmaps, or standards, baselines, we see a lot of progress moving forward. However, there were areas that required more support. For example, monitoring of WASH within HMIS, only 14% of countries have reported completing this step. So we use this data to help guide where there were gaps and where we could utilize more information to go forward. Next slide. And we developed 3 key recommendations. The first recommendation is to integrate wash, waste, and electricity services into health planning, programming, financing, and monitoring at all levels. The second is to regularly review and monitor progress and strengthen accountability. And the third is to develop and empower the health workforce to deliver and maintain these services and to practice good hygiene. And you'll see that these 3 recommendations, which we put forth in this report, really featured strongly in the UN resolution and the framework for action. Next slide, please. So 2023 December, this big moment, the UN General Assembly came together and they unanimously adopted this resolution on wash, waste, and electricity in healthcare facilities. If you haven't read the resolution, I recommend it. It's not a super long document. Perhaps Arabella can drop a link to this in the chat. But in short, it requires or asks of countries to integrate and maintain wash, waste, and energy services into health sector planning, programming, financing, monitoring, and evaluation. So you see again the correlation between what we had said in the progress report, to empower the health workforce, and to strengthen international cooperation. It calls on partners to enhance coordination, strengthen existing global initiatives, and bolster efforts to increase data coverage. And then it calls on UN agencies to promote the optimum use of resources and support countries at their request. So all of this came out in 2023. This is important because if you look back at the 2019 World Health Assembly resolution, that was our first global policy document focused specifically on wash and healthcare facilities. It sparked action, it brought greater attention, but the reporting process for the World Health Assembly resolution actually closed in May of 2023. So while it was really instrumental, it was critical for us to have another piece of global policy that would help move us through the SDG period to the end of 2030. So the UN resolution not only picks up where the World Health Assembly resolution left off, it's actually whole of government commitment, whereas the World Health Assembly resolution focused specifically on ministries of health. It supports greater integration and cross-sectoral efforts, and also it brings in a closely related topic. It brings in electricity in healthcare facilities. The unanimous adoption demonstrates the global support. So I would consider this a key piece of advocacy for your own work with your governments, because your whole of government committed to this resolution last December. And it'll be guided, of course, by the Global Framework for Action, which I'll go into. Next slide, please. So this Global Framework for Action is really meant to support the implementation. Think of this as operationalizing the language within that resolution. If you think that language is a little difficult and policy wonky, then this is going to help you interpret that and turn this into a plan for yourselves. So there are key aims of this framework. The first, to increase political commitment and leadership and to scale up investments. We know that's a great need. Again, to support system strengthening and integration, repeating these same key messages and these same key recommendations throughout. To develop, resource, and implement costed roadmaps, to regularly monitor and review progress, to strengthen the health workforce, and to support inclusive and equitable services. Next slide, please. So I believe Arabella has just dropped the document in the chat. I would recommend taking this document out, taking a look at it, reading through it. It is not a long document either, but you'll see it's broken into 2 phases. The first gives you the framing and the context. Part 2 gives you the actual operational actions and metrics. And within that, there are targets for tracking and reporting. The first set of targets are system targets. They're based on the 8 practical steps. So again, integration across these key tools you've heard about. So we'll be focusing on how to track the national standards, costed roadmaps, health system monitoring, gender, disability, inclusion plans. It's also critical to note that there are integration from other major plans like the IPC plan. The IPC Global Action Plan was launched at the World Health Assembly this past May, and we've made sure that there is alignment between these plans and alignment between these tracking and the metrics. There's also service targets looking at tracking water, sanitation, hygiene, similar as we do for the JMP, with the same targets and reporting back for SDG 6. And there'll be regular reporting on these metrics as part of our response back to the UN Secretary General and the General Assembly. The first report back will be in 2025, next year, and then again in 2028 and 2030. So this is really taking us all the way up to the end of the SDG period. This is some examples of what the document looks like in terms of the metrics and the targets. I would, again, take a read through. I think it's helpful to go through and look at this as compared to your country's progress on some of these things. So you may be aware, for example, if your country has already established a baseline, or whether you have implemented a costed roadmap. So seeing what the targets are and where you currently are moving forward and where there are current needs for you to advocate and to drive forward action. Next slide. There's also, again, areas on service levels. For those of you who might be working more at a subnational level, this will be interesting to look at in terms of the availability of WASH services in your facilities. But I think it's also critical to think about some of those system strengthening that might seem quite high level, how you apply that at a subnational level. So within your district health offices, is there sufficient funding? Next slide. And then, of course, we have to include equity, inclusivity, and community engagement. So ensuring that countries have plans for ensuring inclusivity of WASH services. Again, this is critical if you're working not necessarily at the national level, thinking about how this would apply to the plans and the ways you're providing services within your own health system, your own subnational efforts. Next slide. You know of the WASH Fit tool. This is not separate. This does also fall within our efforts of the Global Framework for Action and the UN resolution. It is, of course, a practical tool for facility level improvements. It's been used in about 70 countries and it covers water, sanitation, hand hygiene, waste, cleaning, energy, and management. It's based on catalytic practical actions and quality improvements. And we have numerous country examples, whether from the Ukraine, where they're using it as part of IPC efforts, in the Philippines, where it's being used to establish higher standards, or Mali, where they're using locally designed water and sanitation systems to reduce maternal and newborn mortality. So I think what's really critical about this is, as you think about the global framework and you think about how do we actually go from these big implementation plans and these costed roadmaps, using the WASH Fit tool as a way to actually bring those metrics forward to reach those goals. So for next steps, we recommend, again, these really broad efforts, but I think they're really critical to drive home. We need increased political commitment and leadership. And that comes in part from you all and the advocacy that you do, whether it's with your ministries of health and water, whether you're talking to your local healthcare facility management system, whether you're talking to district health providers, all of them are critical, having their political commitment, having their leadership on this issue, and making this issue prioritized. Similarly, as we scale up investments, that is critical with our donor partners, as well as it is internally, ensuring healthcare facilities are not only budgeting for this, but that ministries of health are increasing their investments in this issue. We need to support system strengthening and integration. Something we can all advocate for is ensuring that WASH, waste, and electricity services in the context of climate change are part of health system processes, like the monitoring system, which we saw on that early slide is one of the lowest areas amongst countries, but really needs to be part of the system, making sure we're regularly monitoring. You need to develop, resource, and implement costed roadmaps and regularly review progress. And then capacitate the health workforce through training and mentoring. Again, this is a critical area where the community of practice can be very useful, helping support these efforts to ensure the health workforce across countries has the information and support needed to deliver safe wash, waste, and electricity services. And of course, we count on you all to ensure that these efforts are being undertaken in an inclusive and an equitable manner. So I think I will close off there just to say we know progress is possible, and we are seeing that every day. The last progress report demonstrated significant increases in countries, but it also demonstrated that there's a great need and there are major gaps. And so together, working across this new global framework for action, there is the possibility to move forward and reach that SDG 6 goal by 2030. Thanks so much.
Thank you, Lindsay. What a great orientation to the global framework for action. Next, I'll welcome up our first case study with Mr. June Philip Ruiz. Mr. Ruiz holds a Master in Management Engineering and is a licensed engineer, certified BERD professional, Green Accredited Design professional, and accredited assessor. He is a development management officer level 4 for the Ministry of Health Philippines, the Health Facility Development Bureau, and the program manager for the Green and Safe Healthcare Facilities. June Philippe, feel free to unmute yourself and start your presentation.
Thank you, Darcy, for that kind introduction. So let me share my slides. Thank you for that. So as we look into the Philippines right now, we are having or we are looking towards and where we are now. So we are now in terms of the green and safe health facilities. We are now investing in terms for the resiliency and the sustainability. As we all know, we look towards the Philippines growing, especially that we are looking towards or somehow we are looking towards the development of our
June,
hospitals and
I'm sorry to interrupt you, but your audio is very quiet. Is it possible to move your microphone to be closer?
okay. My apologies. Hello.
It's mostly the same.
Okay. Hello. Hello.
No, we're still having, it is working. We hear you a little bit, but you're very quiet.
Okay. Hello. Is my audio clear? Uh,
Here, can I suggest, June, if you're okay, and Seema, I think you're still on the line with us. My suggestion is that we switch the first and second case studies, and then June, that will give you a second to see if you can fix your audio. Seema, are you there? Is this?
Yes, Darcy, I'm here.
Okay, great. Let me just jump forward in the slides. Okay. Thanks everyone for your flexibility. So we're going to swap the order of our case study presenters today. We have Ms. Seema Rajuria, who is the Head of Policy and Advocacy for Water Aid Nepal, who's going to speak on the implementation of the Global Framework for Action in the Nepal context. Seema, the floor is yours.
Thank you, Darcy, and good morning, good afternoon, good evening, everyone. I'm very happy to get a chance to present what Nepal is doing to smoothen the way to adapt and adopt the global framework for action. Darcy, I cannot see my slides. Yes, thank you. Thank you very much. I will first talk about the initiatives that the government is taking and then show how Water Aid Nepal as a stakeholder is supporting the government in their vision. And next slide, please. So Nepal is very good at making policies, especially from the time we became a federal nation in 2015, when the new constitution came out and the first ever elections for a federal state took place in 2017. The new governance system divided the roles and responsibilities of various aspects to all three tiers of government, with some as concurrent rights and some as exclusive rights. Basic health comes under exclusive right of the local governments. But then again, what happened is that the division of roles and responsibilities also meant division of capacities. And the local and provincial governments were not the first choice of the bureaucracy. So most of the legal documents that you see here were made at the local, national level, and they are then cascaded down to the local government. But the government has done quite a bit of work, including adapting the wash fit tool, which is in the right-hand side of the screen, to the national standards. Next slide, please.
Yes, Seema, it seems like others are having the same problem. It doesn't appear that you're muted, but your audio has cut out all of a sudden. Unfortunately, we're still not hearing you. Hmm. Yes, I suspect I'm seeing others in the chat are also reporting the same issue. So I suspect that the problem is something with your microphone. Yeah, switching to your phone is probably a good idea. No problem. Thank you for your patience, everyone. This is just one of the things that comes along with having such a diverse and engaging audience joining in from time zones all over the world. So no problem, Seema. We'll give you a minute just to reconnect through your phone, and then we'll pick up the presentation. Thank you for your patience, everyone.
Hello?
Hello? Hello? Great. Seema, the audio from your phone is patching in, but we're perhaps it's fixed.
Hi, Darcy. Is it okay now?
Yes, great. Perfect. Thank you.
Okay, great. Great. So shall I start from the beginning or shall I start from this slide?
Why don't you just pick up from the top of this slide?
Okay. So this is about engaging leaders and stakeholders. So the government, as I said, has been open and receptive to health improvement more than in other areas. For example, WASH, and this can be seen in the slide here where we can see various international and national events the government has been engaged in and has been hosting since 2017. And the government also realizes that WASH and healthcare waste management are closely associated and they have to be coordinated with other areas like climate. And so what it has started doing, it has started aligning its programs with that of climate and of also the nationally determined contributions of the country. And one example I wanted to cite here is that they have now prohibited burning of waste in almost 1,400 healthcare facilities, and they want to reach this target by 2030. And the health sector also realizes that it cannot function successfully without proper coordination with other tiers of government. We have three tiers of government. One is the local government, the provincial government, and the federal government. And it has launched advocacy awareness raising programs in provinces and local governments also. And this has been done in support of WHO, UNICEF, WaterAid, and other sector partners. This has also helped to pave the way for smooth alignment of key performance indicators, which will ultimately help meet the SDGs at the national level. Next slide, please. So actually, many elements have come together to enable healthcare facilities to support WASH and healthcare waste management and environment cleaning. And foremost among them, I would say, is the willingness of the government to go the extra mile. There is a dedicated section called Environment, Health, and Healthcare Waste Management section under the Management Division of the Department of Health Services that comes under Ministry of Health and Population. And they have demonstrated some good practices like utilizing the COVID-19 funds to buy equipment to support healthcare waste management through the purchase of autoclaves and other cleaning equipment. And the government also supports hospitals through focused monitoring and implementation. And there are various guidelines, standards to ensure things are kept in check. Next slide, please. And these are the ways in which the government makes sure that WASH in healthcare facilities is effective. There is a detailed assessment done that entails assessment of hospitals' readiness to work in healthcare waste management, WASH, and IPC. And then that is fed into the infrastructure development and equipment supply, where, again, certain things are done. And then which again feeds into WASH in healthcare facilities and healthcare waste management interventions, where training of trainers is conducted and other various things are also done. Behavior change communications is also a very good practice that the government has been doing. And then that finally feeds into the evaluation and follow-up. Next slide, please. So by following strict rules and regulations, healthcare facilities have managed to create some impact. And this is one of the examples of how waste is managed. As you can see in the pictures, I'm sorry, the pictures are very small. This is how health care waste is segregated and then treated. We can go on to the next slide, please. So this has actually resulted in the older practice of directly disposing of waste in landfill sites of the municipalities. Waste is now disposed of in a more organized manner and that with minimum risk. The practice of selling it to waste collectors and waste pickers is still there, but there are organizations that train the waste pickers also, though this is a whole new area which needs its own rules and regulations. Can we go on to the next slide? So though we are getting on the right track now, there have been many missed opportunities. For example, it was reported that almost 55% of waste is recyclable, and this was done. The study was done in only 13 hospitals. So we can imagine the amount of waste that is still recyclable if it is properly segregated and treated. So this is something that we need to look at properly. Can we go on to the next slide? There are barriers for, though we are doing well, there are many barriers to success and sustainability, and these are some of the barriers that I have put in here. And they are inadequate technical knowledge of health sector and lack of dedicated human resource. Procurement is always a practice. Operation and management is always a practice, because this is mainly due to lack of sufficient funds. And this year also the new budget has come out, and in the health sector, the health budget is only 4.6% of the total budget, which is very, very less. And it is less than what it was allocated last year. And evidence and advocacy is also lacking, though we do have these learning platforms and there is a lot of advocacy done, this is not enough. Most of the advocacy is being done in the national level only. This has to trickle down to the local government level. And replication of WASH and healthcare waste management and good practices have to be trickled down to rural healthcare facilities also. And then, like I said, we have three tiers of government. Though there is comparatively good coordination in the health sector, the coordination itself is not enough. There has to be better collaboration and coordination for smooth functioning. And data is always a big problem, not only in Nepal. I think this is a problem everywhere. We have to do good on data. If we can move on to the next slide, please. This is the Nepal country progress. Just wanted to show it here. We are doing well. This is the same. This, I think, is from the previous report, but I checked it with the current report and the status has not changed. Next slide, please. So the government has made plans, and rightly it is thinking from moving from the district to basic level health facilities. And the financing of the costed roadmap is still ongoing. And it is still working on cheaper climate smart non-burn techniques, which can be replicated in other parts. And immunization waste management is also something that is being looked into, and clear guidelines for the expired COVID-19 vaccine management is also being looked into. And strong evidence comparison of different methods, including non-burn, in addition to existing WHO guidelines and recommendations, is something that the government is also looking into. And it's also trying to bring technology closer and cheaper to LMICs. If we can move on. So WaterAid Nepal is working very closely with the government on healthcare facilities and healthcare waste management also. And the approach we are implementing is the system strengthening approach, which WaterAid uses in its work. We work through the building block of the system strengthening tool to help break down the complexity of the system in more tangible components or parts, so that development becomes more holistic. And we do this so that we are able to identify entry points and help us in designing programs and projects that work on the whole system. And I'm sure that many of you who are on the call, this isn't anything new, but we are working with the government, taking this approach, and we will continue to do that in the following months and years. And you will see that the health system building blocks are a reconfiguration of the WASH system building blocks. So both WASH and health sectors have frameworks for system strengthening, and there is alignment between the two. And WaterAid lends the system thinking into the underlying principles associated with the human right to water and sanitation, as well as efforts to build solidarity and empower all people to collectively claim their rights while fulfilling their own obligations. Next slide, please. And you can see the alignment in this slide at the top. I think we have next slide, please. Thank you, Darcy. You can see the alignment in this slide. At the top are the six health system building blocks. Under each of these, we placed WaterAid's WASH system building blocks. There are 11 building blocks in the WASH systems building blocks to illustrate how they can be integrated within the health system framing. Although the building blocks are different, there is a lot of overlap, and it's possible to see how WASH building blocks can be embedded within the health building blocks. And the important point is that both sectors emphasize a systems approach. Next slide. So globally, WaterAid works in the 5 pillars. It works in WASH and waste and environment cleaning. And we will continue to work in these areas with the government. And we have just launched a new country program strategy where we have prioritized WASH in public health and looked into areas where we can provide support to the government. And one has been WaterAid Nepal, and WaterAid itself has been working extensively in healthcare facilities to ensure safe WASH systems, and is now exploring how we can take that into healthcare waste management also. We believe in modeling in a few places and then influencing the rest. So that is going to be our approach. Next slide, please. Yeah, thank you. Thank you very much.
Great. Thank you so much, Seema, for that presentation. Great to see how Nepal is taking action in support of the Global Framework for Action. Very exciting. I'll turn it back to June Philip Ruiz. I'll move backwards through the slide deck to your section here. Hopefully you've been able to reconnect and we'll be able to hear your audio a bit more clearly.
Hello, Darcy.
Yes, much better on your audio. Let me
Thank you.
just restart your slides.
Thank you for that. So, apologies for the earlier technical problems. So once again, I am Engineer Philip Ruiz from the Philippines Department of Health. The Department of Health developed an 8-point action agenda aligned with the Philippine Development Plan 2023 to 2028 and building on the accomplishment of the past health sector strategies. The Philippines remains at risk of emergencies and disasters and is currently at the top position in the World Risk Report of 2022. Based on the status of the Philippines in the World Risk Index, it is now the goal of the health sector to reduce the health impact of the disasters through the institutionalizing the disaster risk reduction and management and health, addressing the problems in the state, a whole of government and a whole of society's approach. The environmental health issues of the Philippines are growing at the exponential rate at a rapid pace. Climate resilience and of the healthcare facilities in the Philippines has been undergoing a series of the development activities. In light of the Philippines' approximately 30,000 healthcare facilities, it is very timely to support existing government policies and laws on climate change, green building, disaster management, and universal healthcare. We must all work together to achieve our goal of protecting the health of the present and the future generations of the Philippines. Next slide, please. The vision of the Universal Healthcare Act. Yes, ma'am, yes. It envisions an equitable health system where everyone in Wana can access appropriate and quality healthcare without financial hardship. Through the Philippine Health Facility Development Plan 2040, equitable access to the health system is the goal. The Philippine Health Facility Development for Apple. So yes. So I'll continue. The Philippine Health Facility Development Plan is the master plan for the infrastructure and medical equipment investment to ensure that our health system can meet the demands of the universal healthcare coverage. The concept of the framework, building resilient and environmentally sustainable healthcare facilities. The four areas of this intervention includes achieving the climate resilience and environmentally sustainable health facilities infrastructure, under which the plan is identified essential features of all modern and future health facilities in the country. The investing with these features have two primary goals: to improve the climate resilience and environmentally sustainable. These features were adopted from the WHO's guidance of the climate resilient environmentally sustainable health facilities. So kindly click again. So through the hospital accessibility analysis was done to calculate the proportion of the province's population who have access to the hospital within 1 hour and to the primary care within 30 minutes. Next slide, please. Yes, ma'am. Okay, this was the accessibility access that was incorporated to the Philippine Health Facility Development Plan. Next slide, please. Okay. In terms and alignment with the development of a climate resilient health system, the health system shall be prepared and have the capacity to recover from and adapt to the future disasters and related crises. The Department of Health's 8-point action agenda includes the agenda item, Bawat Komunidad Handa sa Crisis or Be Ready with a Crisis, which prioritizes the development of responsive and resilient health system that can effectively prepare for, respond to, and recover from the health emergencies and crises. Aligned with this, one of the strategic intervention of the agenda is to strengthen the climate resilience and environmentally sustainable of the health facilities. It is our commitment to develop the health facilities that are climate resilient and environmentally sustainable of at least 50% of the government hospitals by 2028 shall be recognized as green hospitals through the Green Viability Assessment System. Next slide, please. To respond to the global call, and apologies with that. So as you can see, this is the Green Viability Assessment System. This is aligned with the green rating of the hospitals under the Green Viability Assessment System. Part of our validation, recognition of the hospital using the Green Viability Assessment tool to determine the compliance of the green and safe health facilities and climate resilient performance standards. We have the 8 performance standards that includes the governance, the energy efficiency, material sustainability, site sustainability, water efficiency, sanitation and hygiene, healthcare waste management, environmentally resilient health facility, and indoor environmental quality, which also align with the safe, climate resilience, and environmentally sustainable healthcare facilities that are essential for delivering a high quality care and achieving the universal healthcare coverage. As you can also see, we have provided the water efficiency, sanitation, hygiene, which includes or prioritizes for the wash fit, which also promotes that through the development of the localized wash fit we are now using in the Philippines. There is also the energy efficiency with alignment with the Energy Efficiency and Conservation Act. We have also incorporated the Sustainable Healthcare Waste Management that also includes how the health facility shall manage and encourage with the development of the healthcare waste management plan of their health facilities that aligns with the strategic and interventions of the waste minimizations. We have also the material sustainability and site sustainability with the indoor environmental quality that also promotes the infection prevention and control
and other programs or the health facility development programs. Next slide, please. In terms of the objective of the green and safe health facilities, we look towards the Green, Safe, and Climate Resilient Health Facilities Strategic Plan 2030 shall provide a detailed sustainable program and overall direction in the planning, financing, implementation, monitoring, and evaluation of the green and safe health facilities. It includes, at the early stage of the infrastructure project, we shall be incorporating the green standards or the green and safe health facilities guidelines. We should also promote the climate change and expenditure tagging. We should also provide the monitoring and evaluation. Through this, we are going with the green viability assessment system that incorporates the system that will promote the greening of our health facilities. Next slide, please. In terms of in terms of the green and safe health facilities framework, on the left side you can see here are some of the national policies and the national laws that we incorporated in terms of the green and safe health facilities. We have the Code of Sanitation of the Philippines. We have the Philippine Clean Air Act, which we are invited to use incineration. We have also the Renewable Energy Act. We have the Climate Change Act of 2009, the Philippine Disaster Reduction and Management, and of course, the Philippine Green Building Code. With these policies, through the help of the World Health Organization, we have developed the Green and Safe Health Facility Standards and Technical Guidelines that was circularized through the Department Circular number 2021-0437. Aligned with this, we ensure that through the Universal Healthcare Act and the alignment of the 8-point action agenda and the Philippine Health Facility Development Plan will be the overall goal of this policy item, of which by 2023, we have also provided the guidelines for the localized wash fit, which we align with the national and local mandates in terms of the water, sanitation, and hygiene for the health facility. Also, it also promote the sustainable healthcare waste management. This is the fourth edition of our manual in terms of the sustainable healthcare waste management. So this was released as of 2020 through the department circular. Next slide, please. We would also like to promote the guidelines on the green and safe health facilities through the integration of the climate and disaster resilient measures in construction of the health facilities, not only towards the strengthening or the resiliency factors being mentioned earlier, we are also looking towards the integration that ensuring the building design of the health facilities that can withstand the typhoon with the minimum speed load of 300 kilowatt per hour. There's also the seismic and earthquake load as a requirement of the specified under the applicable code and ordinance, which is also aligned with the environmentally resilient health facilities that the hospital shall be the last building standing. Next one, please. In terms of the green and safe health facilities, we are looking for the program to be the leader in the green and safe health to be the leader in the green, safe, and climate resilient health facility development, which also envisions that through the Department of Health Facility Development Bureau is a team of a driven, innovative, and competent professionals that develop the policies, plans, standards, and programs that will provide technical advisory services and capacity building for a safe, resilient, and sustainable health services and facilities to ensure universal access to the quality healthcare. In terms of our objective, that by 2030 of at least 50% of the government hospitals and other health facilities owned and operated by the national and local governments are implementing green, safe, and climate resilient health facility development. Towards the end, the green, safe, and climate resilient health facilities would like to strengthen the green and safe health initiatives through the green viability assessment system. It is also to improve the availability of the high quality data on the impact of the climate change on the health, particularly in less resilient location. Also, to raise awareness of the stakeholders and policymakers regarding the consequences of climate change on health and continuous improvement and implementation of the safe, sustainable, and resilient health infrastructure. And again, as part of the green and safe health facilities we promote for the bagong Pilipinas, bawat buhay mahalaga. Thank you, Darcy.
Great. Thank you so much, Mr. Rees. It's great to see how these green and safe climate healthcare facilities initiatives can contribute to supporting the overall global framework for action from the WHO and UNICEF. With that, I will turn it over to the audience for questions. I'll invite all of our speakers, and I know that some of our speakers have colleagues in the audience as well who may want to participate in the question and answer session. So if you are one of our speakers or one of our colleagues of one of the speakers, please feel free to unmute yourself, come back on video, and join us for a panel. If you're a member of the audience and you have questions, please either raise your hand to ask your question live or type your question into the chat, and then I'll moderate the chat and I'll read questions out that way. To kick us off, I'm wondering if Lindsay or Maggie, I see you've come on video there. If you want to briefly reflect on the presentations from the Philippines and from Nepal and how they're supporting the framework, and how you might see some of those initiatives perhaps scale up, or what other countries might do to support green healthcare facilities or some of the other things that have been talked about within the framework.
Maggie, do you want to go ahead since you haven't had a chance to speak?
Sure, thank you, and apologies for my voice. Yeah, I think two thoughts come to mind, and maybe would love to hear reactions from Philippines and Nepal. The first is how they kind of got over that hump of getting the political will, because it was really clear in both those presentations that there's strong government support, backed by government policies, even government funding. And we have found that that policy regulation and the funding budgeting elements are really critical to scaling up. So would love to hear more about that. I think the second thing, while we know it's a systems change dilemma, and appreciated that, especially from the Nepal presentation, there are, there is a need to make sure we're implementing the most environmentally friendly, sustainable, cost-effective technologies, and was really curious to hear a bit more about some of those green technologies that other countries can adopt, especially in low resource settings. So yeah, I wanna thank you, Darcy, for bringing this all together, and for our presenters.
I'll pass that back to some of our other speakers. Mr. Rees or Ms. Rajuria, any reflections on what Maggie said with regards to green technologies or engaging government through advocacy?
Thank you, Darcy. Maybe I'll start with regards to the leadership and the governance of our government. So I think I would also like to emphasize that there's the great opportunity for the Philippines with the COP28 and through the membership of the attach, since we have recently been part of the attach, and we have committed for our low carbon sustainable healthcare facilities that also promotes, especially for the greenhouse gas emission that we are looking into. We are now looking towards to help, of course, as we know that the climate crisis is a health crisis. So with this effect, with the support from the top management of the Department of Health, we are going or ongoing with our commitments to especially improve in terms of our monitoring and evaluation, and to provide some of these some of the metadata that will be used so that it will be implemented not only at the national level but also at the local government units. As we look into the implementation of the green and safe, or implementation of safe, resilient health facilities, because Philippines, as we know, of around 15 to 20 tropical cyclones that we are experiencing annually. That is why we are promoting our health facilities to become resilient in terms of its infrastructure, in terms of its non infrastructure, the functionality, and of course to promote the services during and after the emergency. So with this effect, we see that there's the need to somehow promote this kind of interventions so that it will be implementable through the policy, through the policy from the national government. It was cascaded to the local government and to the regional counterparts, and provided the capacity building so that it will be implementable, and it will be also not only from the national level, but also with the local government units to somehow improve or to somehow adapt these good qualities. And of course, maybe because we have also promoted through a conference or through a summit, we are doing this to share the good initiatives from other hospitals or other government hospitals so that they could promote their best practices and to guide them and to promote also what is needed and what will be a good initiative that will be adapted to other health facilities. Thank you.
Great, very interesting. Thank you. Seema, I'll give you a chance to weigh in here, and then there's a question in the chat.
Thank you, Darcy. Can you hear me?
Yes, we can. Thank you.
Okay. Yes, getting the political will has been a long and arduous journey. It requires a lot of advocacy work, and it does not really help because the government is not stable in Nepal. And at this point in time, I would like to invite my colleague Upama, who is on the chat and who has been working in this sector for many years now, and who has been directly involved in doing a lot of the work that I showed here today. So, Upamaji, if you are here, would you like to answer this question in more
Yes,
detail?
Seemaji. Thank you so much, Seemaji. Adding on what Seemaji has mentioned is our journey was very long. Evidence-based advocacy was one of the key steps what it took, and Washington Healthcare Facility resolution was another milestone, or was another milestone for us, and that made us advocate with the local government as well as the federal government, to push what a sanitation hygiene agenda in healthcare facilities as well as healthcare waste management agenda there. And we still have a lot of work to be done at the local level. So we are working with the government, and our journey, what a particular journey working with the government has started back in 2012 on Washington healthcare facilities, where we were doing some kind of assessment of Washington healthcare facilities, trying to convince them to bring them on board to invest more on Wash. So, but finally, with strong political will, we have come to this stage to convince them to at least plan to attain this global framework. So we will work together with the government on this line. Thank you.
Perfect. There's a question in the chat for the Philippines. It says, will there be new definitions for healthcare waste, particularly infectious waste? We recognize that more infectious waste entails additional costs for treatment and handling.
Apologies. Thank you for that, Darcy. So in terms of the infectious waste, so we align with the international standards and definition of the infectious waste as part of the hazardous waste. So we have also provided it in the definition of terms for the Healthcare Waste Management Manual, 4th edition. So this type of waste is most likely to contain the pathogens like the bacteria, viruses, parasites, and fungi, insufficient with the concentration of the quantity of to cause the diseases in susceptible host. I think it is more likely to check upon since the Department of Health provides the guidance and the policy in terms of this aspect, but it is more it is more the way of how we will coordinate with the regulatory framework, because as of the moment, in terms of the policy side of the healthcare waste management, the definition per se will be coming, of course, in terms of its of our alignment with our international definition. But in terms of the handling of waste and the treatment of waste, it will fall upon with our regulatory and how they will provide framework of such, so that some of these not only for the infectious waste but other hazardous waste as well will provide on how we will
have the policy and process on how these hazardous waste will be treated accordingly. And of course, with the environmental impact, we will check also this impact that will promote not only for the environment but also to the health of the many. Thank you.
Great, thank you. We'll close with one final question in the chat. It's a comment on engagement from private sector. So I'm wondering if either Lindsay or Maggie, you might want to weigh in to speak to how the private sector could contribute to advancing the global framework.
I'm happy to jump in here first, and then Maggie, if you have something further to say. I think, first of all, if I'm not mistaken, this is a private sector, private health provider. I think, whether we're talking about delivering care to public healthcare facilities, private healthcare facilities, faith-based healthcare facilities, at the end of the day, every healthcare facility requires basic wash, waste, and electricity services. It doesn't matter who the operator is. And so if we're working with private healthcare facilities, I think critical that you also take a look at these guidance documents, take a look at these, the Wash Fit tool, the global framework, look at your own healthcare facility and identify your own gaps through these assessments and start making a plan of how you can, bridge these gaps. I think it's also valuable. Most private healthcare facilities in most countries fall under the Ministry of Health, whether or not they're, actively monitored by them. But, connecting with the local Ministry of Health to understand what are their plans and how can you help contribute to their efforts. Really, this is a global initiative. It's going to take all entities and all parties to help move this forward. In addition to the private health message in the chat, there's also, I see multiple faith-based providers here on this call. So whether you're the Zimbabwe Christian Health Association or the Kenyan Christian Health Association, you too all can help drive this forward by looking at your own facilities. So I say, make those connections, start looking at your own facilities, and then help report back. You can share your work back through washnhcf.org, share experiences, share your stories, and help us demonstrate that momentum. I think that's really critical to be part of this. And Darcy being part of your community of practice. I think there's always a welcomeness to join these calls, share experiences, and learn. And maybe there are things that are happening in the private healthcare facilities or faith-based healthcare facilities that the public facilities can learn from. So I'll leave it there. Maggie, I don't know if there's anything else you'd like to add.
I know we're past time, but just really quickly, just to kind of emphasize the role of catalytic funding and innovation. And I think those are two things that the private sector also brings to this work. Very much, we recognize most of the funding needs to come from government, and it needs to be regular and it needs to be set aside. But there are specific, I think, innovation and also that catalytic funding that the private sector plays as well. Thank you.
Great. Well, a big thank you again to all of our presenters, especially, I know it's late for folks in Asia, particularly in the Philippines. So a big thank you to everyone for joining, some great presentations. Very exciting to see the framework being rolled out and to see how that moves forward. So thank you again to everyone for joining. I'll close this webinar here, but materials from the webinar and the recording will be made available online in a week or two. So thank you everyone for joining us.
Bye-bye.
Thank you.
Goodbye. Thank you. Thank you, Darcy. Hey, Maggie. Hi, Lindsay.
Hi, Philip.
Thank you. Have a good day. Bye-bye.